Hi, I'm Ginille. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers, doing skin treatments since 2013. Please feel free to hop in, ask me your questions. I can talk about the treatments we offer in our office. We've got 3 offices, 2 in Los Angeles, 1 in Las Vegas. We see patients of all skin types, all skin tones. We really focus on skin health, hair health, and then natural looking outcomes. So we do Botox and filler, but it's never overdone. You're gonna look like you. You're gonna look like yourself, fresh. That's always the intent. Please feel free to ask any questions. I can talk through, again, treatments that we offer in the office, and I can show you patient before and after photos of people that we have treated. And go through some of the most frequently asked questions that I hear from patients. If you don't have questions, if you have questions, drop them in the chat, or we can jump on and we can do a consult on live. Okay, I will flip through some of these and I can talk to you about the patients and what they have done. She's so beautiful. Let me see if I can make this a little, not me bigger, her bigger. So she came in, she wanted something a little bit more. She said, I want to be snatched. She wanted more, oops, sorry. I don't want to do this right now. She wanted more highlight in her cheeks, and then she wanted her lower face, her chin to be, her jawline to be elongated. So that is what we did in this before to after. Here is a nose patient before and after. I'm going to move this to the side. So she felt like when she smiled, the tip of her nose curved down and she wanted it to curve upwards instead. So we did some filler. This took less than 15 minutes. You can see the results immediately after. It lasts 1.5 to 2 years when we do nose filler. I do noses of all ethnicities, everybody's noses, full noses, thinner noses, and I can click through some of those, but we can camouflage a bump. We can lift the tip of the nose. We can highlight the bridge of the nose. And so you can see in the front, this is what it looks like. It creates more of a highlight, a little bit more definition when we build up the bridge. What procedure do you use for the jawline? For jawline, a few things depending on what your concerns are. If you're trying to elongate the jawline or make more defined, we'll use filler or the natural filler. I can try to hit through some jawline photos. Oops, sorry. Or if you are trying to tighten the neckband, so these right here, we'll do Botox to help tighten along the neck. Or if you're trying to slim the lower face and your lower face is wide from overuse of these masseter, these jaw muscles, we can slim the face with Botox as well. And so I will keep flipping through. She wanted to balance her upper and lower face. She felt like her chin set back. So we did some filler into her chin to bring her chin forward, and that enhanced her jawline. Everything just looks a little bit more harmonized in her before and after. Here's another nose. I was talking about noses a few minutes ago. So she wanted to lift the tip of her nose and she wanted to camouflage the bumps. It's pretty subtle, but for her, it was really profound. So she liked that. Here's another one that wanted to do her nose. She wanted to camouflage the bump and make her nose go upwards. And then she wanted to elongate her jawline because her chin set back. Yes, for any under eyes, we got lots of under eyes here. So here's one we did under eyes, a little bit into her cheeks, her lips, and then into her chin. For her eyes, she just felt like she's a little sunken, and so we did some filler to camouflage the fat pad underneath the under eyes. We all have fat pads. Some people's show more than others, so we're trying to bring the skin underneath that fat pad up. I'll flip through some more eyes. Let me see. Here's another set of under eyes. You can see it just kind of helps hide the eye bag. And then we have some I have here that are a little bit more profound. For her, she had the eye bag that like bulges out. I told her only surgery can get that eye bag gone all the way. So I told her do surgery. She's like, I'm never going to do surgery. Ginille, do what you can. I don't want to do surgery. And so I did filler underneath the fat pad from here all the way around to lift the skin and then hide the fat pad. And so I tell patients 1.5 to 2 years that it lasts. A lot of people get longer out of it, which is so great. Let me show you some more under eyes. This is another girl. I said, hey, would you do surgery? She's like, I never want to do surgery. So we camouflage that fat pad with filler. You can just see it looks lifted, it looks bright. The fat pad is hidden. It's not taken away. Only surgery can take away, but it hides it. Another person camouflaging fat pad underneath the eyes, doing a little bit of filler into his mid face, and then doing some jawline filler to make the jawline look more square, more defined at his chin, and fuller there. For hollowness underneath the eyes, yes, let me show you some more. Hollows, this is another one trying to camouflage fat pad. And then this one is another one for under eyes. I mean, these people are doing like multiple things. She did under eyes, she did her lower face, her lips as well. Here she did some filler into her chin to bring forward her chin. She's naturally fuller cheeks. More of her features and her highlight is in the mid face. And then we did some filler here to balance that lower face. Never do filler. It does not dissolve. It warps your face over time. Well, these are patients. I mean, I've had a bunch of filler over my face all over the years. And these are patients that have done filler all over their faces and they look natural. They look good. I've been doing this as a cosmetic nurse practitioner since 2013. I went to Stanford. I went to Duke. I have 3 medical spas. I see patients from all over the world and focus on natural looking aesthetics. I'm trying to show you guys, hey, it doesn't have to look crazy. It doesn't have to look done. But thank you for sharing, lady. So here's some other patients that have done filler. So you did some into her mid face. She felt like her cheeks kind of set downwards and then she wanted it to look more lifted. We're changing that highlight up and then her chin was kind of short. And so we gave some length to her chin as well. What do I recommend for under eye for tear trough? For under eyes, if you're a candidate for filler, you can do filler. So candidates who would not be a candidate for filler is anyone that cries a lot, gets really bad swelling in the morning, anybody that retains water, has bad allergies, anyone retains water around their eyes are not going to be candidates for under eye filler. Filler, if you are a candidate for it, if you're more sunken, if you're hollow, you can do filler. Filler is going to lift the hollowness. It's going to replace some of that volume. It can camouflage fat pads. You can even see hers a little bit brighter. It can help hide some of that under eye bag. But filler, again, you don't want to get puffy. You don't want to cry a lot. You don't want to swell underneath your eyes, have bad allergies, or else that filler will look overfilled. It'll look puffy because filler binds water. If you are not a candidate for filler, you can do the natural filler. So that's the one where we draw blood from your arm. We spin it in a centrifuge. It separates out your growth factors and your stem cells. So that part we take out and then we heat it and cool it. When we heat it and cool it, it makes a gel. We can inject that underneath the eyes if you're not a candidate for filler, or if you just want to do the natural route and you want to stimulate collagen over time. You can do the natural filler all over your face, under eyes, temples, smile lines, chin. I've done my whole face with the natural filler for the past 2 years. I'm breastfeeding, and so I can't do traditional filler. But yeah, natural filler works wonders. It just takes time. It's not as instant as traditional filler. So yes, that's Easy Gel, PRF. What fillers do I use in my practice? I use different ones from the Allergan line. So those are like the Juvederm line of fillers, Restylane line, Galderma, and Radius. So I choose different ones depending on the patient, depending on their goals, depending on how thick their skin is, how deep their bone is, and then what we're trying to accomplish. So in one patient, I may be using multiple fillers in the face, and I tell patients it's going to vary from, don't say I want this one because my friend did it. I'm like, your face is different than your friend. Tell me your goals. I'm going to look at your skin and we'll talk about, hey, which filler is going to serve you best. Okay, can you mix my PRF with filler? You can, but I wouldn't do it the same day. So I would do whatever one you decide to do first. People will have different reasons. Some people want the instant result, so they'll go with filler, and then we'll come back later and do PRF. I don't want to mix them the same day because with the filler, I want to see how much it's going to lift. I don't want to have a false interpretation and like overdo. Okay, let me see if, let me make sure I'm not missing any questions. Can we talk about the patient under eyes, like 5 back, dark hair? I have hollows like that. Let me see. Ooh, I was just clicking through. Tell me was she white, black, Latin? Tell me what she looked like. I'll try to flip through. She had dark hair. Oh, I think I know. Hold on. This one? Let me know if it was this one. So she had under eye bags. Let me know. Said tug. Let me know, Paloma, if this is the one you're Latin. Okay, let me know if this was her. So she said, not this one. Okay, let me go. Let me see, not that one. This one? Is it her? Okay, this one? Veronica Joy. I'm trying to see which under eye filler Paloma wanted to look at and talk about. She said she had darker hair, Latin. I'm just trying to see. What do you think about nose fillers? Does it cause blindness? So nose filler works really well for if you want to camouflage a bump, lift the tip of the nose, create more structure along the bridge, minimize like the appearance of asymmetries. If you want to work on the nostrils, you can do that. Some people want to make their nostrils more triangle or more round. It works well. when it talks about blindness, it can cause that. However, I want to say that with like, this is a super rare risk that can happen. When we go into fillers, safety that we're looking for is making sure that we don't have any extreme pain, no vision issues, and your skin color is normal. So we've got blood vessels, our whole face, our whole body. We never want to put too much filler in any spot where blood can't flow like normal. So when we're doing it in their nose, these blood vessels run to the eye. Again, super rare risk. As long as I've been doing this since 2013, so going on 13 years, I've never had to dissolve anybody, any part of their face, any filler for any emergent reason. So it's really, really rare. We just want to be mindful as we're doing this. We don't want to overdo. The more filler we put in one spot, the higher the risk it is to block off blood flow. So when we do filler, I tell patients, do some, let it settle, reassess 6 to 8 weeks. We can always add more. We just don't want to overdo. I'll be in Vegas next on the 14th of November. So like 2 weeks. So come please. Yeah, I'll see you there. I go like once or twice a month. Our team is there. They're seeing patients when I'm not there. They're seeing patients today. And they're there Monday through Saturday, and they're excellent. But yeah, I'll totally be able to see you for your nose and Botox. Send me pictures of your nose too, Andrea, so I can see what it looks like. You can text it to me or send it in the DMs, but make sure you send me your number. And I can like tell me what your goals are with your nose, and I'll let you know if it's like realistic. Okay, Paloma, I don't know if this is the under eyes you were looking for. We were talking about it. I'm trying to see, but for under eye filler, what we're talking about is like minimizing the appearance of hollowness, sunkenness, camouflaging the fat pad. And you said there was somebody with dark hair that had under eyes, so I'm just trying to like flip through them and see who it was. But yes, I treat all skin types, all skin tones. I have seen every sort of thing on the face because I've been doing this for 13 years. This is all I focus in. So yeah, Andrea, I see you send me the pictures. Lips, people will be like, oh, like I don't want it to look overdone. I mean, here's a girl, she wanted to maintain her shape, but she just wanted a little fullness. We're not trying to have it puffy above the border. We're not trying to distort your shape. Other people will be like, do black girls get lip fillers? I'm like, yes, they do. She wanted, she naturally had full lips, but she's like, I want Bratz doll lips. She's like, I want them really full. And so this is black girl that has done lip filler, just so you can do it. Kimmy, what are your thoughts on Radius? I love it. I use a lot of Radius in my office in the right patient. We want to make sure, so Radius is a calcium-based filler. It mimics bone. When I'm really trying to get like more structure or highlight along the chin, along the cheeks, I like that, especially in somebody that has a naturally fuller face. So if she's somebody that has Radius in her cheeks, and my pictures, are they blurry today? I don't know. On her cheeks, in her lower face. You can do it in the smile lines. She is somebody where her chin was more set back. Like, it would take me a lot to try to bring this forward with a softer, like, hyaluronic acid filler. But yeah, we had Radius here. So I use a filler of Radius in Sujia's face, on her lower face, and in her mid face as well. So I used different products on different people depending on what their goals are. Radius in his jawline to make it more angular. Radius in her chin and in her cheeks, so a bunch in her face. So all skin types, all skin tones. These people I'm clicking through right now all have Radius in their face, and I think it is a wonderful filler in the right patients. All these people have had Radius that I was just flipping through right now. I will use, like I said, hyaluronic acid fillers as well. Just depends on the patient, what their goals are, how thick their skin is, how deep their bone is. Thicker skin, so people that naturally have more fat in their face, usually women of color, anyone with more fullness, I need a thicker product. If I do the soft product, you're not going to see it. It's just going to end up looking puffy, or you're not really going to see a change. So I use that product, and I've been using it for almost 13 years. It was the first product I ever learned. Oh, sorry, somebody... Mama Biz, let's talk. We can talk to anything here if you have questions. What you can do on the neck, if it looks old for the neck, you can do Botox into the neck band to tighten these. So that'll give a little bit of a tightening effect. Mama Biz, I'm going to try to see if I can.
Thank you.
Get you on there. You can do, make sure you do your skincare all the way down. Your sunscreen, your retinoid. You can do a thin filler if you have like these little lines and you want to soften them. You can do dilute Radius for collagen stimulation. And then your lasers, your microneedling. Hey, Mama, sorry.
Hey.
Can you hear me?
Can you hear me?
Okay. Yes. Let me make it bigger.
Okay.
How are you?
Hi.
Good to see you.
Okay, great. So here, I've had bags since I was born, and my son lives in LA. So when I saw that you're in LA, and I'm going to be visiting him, what do you suggest?
Do you get puffy around your eyes?
I've had this since a child. Like my childhood photos have bags.
But does it like swell up and down or no? Like, does
It
it get
it,
worse or?
it can depend on if I don't get enough sleep. It can, but most of the time it's just like this.
It looks like that. So I think the best option would be surgery, especially if you get puffy. You don't want to do traditional filler there because regular filler, like hyaluronic acid, binds water. So if anybody that says like I get swelling with whatever, I cry a lot, I got bad allergies, I wake up and it's puffy, I'm like, oh, if we put filler there, it can swell up and down like when you are naturally swelling. Would you do surgery?
Is that blepharoplasty? What's it called?
Yep, a blepharoplasty.
Yes. How much is that?
I don't know. I don't do surgery, and so, but I tell people, I'm like, just know all your options. Like, don't rush anything. Like, I can tell you what I can do non-surgically. I can show you. I've treated eyes like yours, but those are people that'll say like, I never get puffy. Like, it always looks the same, and they have the bag, and then underneath they have hollowness. So I can work on the hollow, but I can't take away that fullness. So that's just kind of like the limitations. And so I'm like, if you're open to surgery, like at least consult, and then you can know, is that what I'm going to do? Is that not what I'm going to do? When people are like, I'm never going to do surgery, I'm like, okay, here's what we can do. We can do regular filler if they're a candidate, or the natural one. The natural one is where we draw your blood, we spin it, we take out your growth factors and stem cells and make a gel out of it from heating it, and we inject that.
Okay.
That one would make new collagen over time. I can't always get it as flat with the natural filler as I can with traditional filler. If I do traditional filler, I just have to make sure.
Yeah, I would be in favor of a filler more than a surgery. I've never really had to be cut on.
You never went? Oh, you never want to? Yeah,
I get it.
I would say. And
I
how
really
often
don't
would you tell that it gets puffy, like around your eyes?
Okay.
How often do you feel like when you wake up it's puffy?
I mean, some days it's not puffy at all, and then other days it's a little bit more. This is mainly what it looks like daily.
I wouldn't do filler just to be, because like if you put filler and if it happens like more than once a month, I'm like, it's not worth it because it's gonna be a headache for you to like swell up and down.
Okay.
Yeah, the natural one. If I do something, I gotta like stand behind it and like get a great result. And so I don't want to be like, yeah, just do this. And it's like, if I can't deliver, I'm not going to do that.
Okay, so you really don't treat puffy eyes if it's hereditary.
Not
hereditary, but
some people, but let me show you some. Like she's one. I can make myself bigger if you need. Can you see this? Am I small or big for you?
It's small for me.
Okay, let me see if I can make it. I don't even know how to flip this back. When we get off, when you get off with me, I'll flip through those. So I don't know how to change it, just so you can see some of these eyes that look similar to yours. But these are people that told me they never get puffy, and so then I'm going underneath the puffy part, underneath the eye bag to camouflage it. They're just like, it always looks the same. I'm like, you cry? They're like, I don't cry. I don't have allergies. I don't care if I sleep or don't sleep. I don't care if I eat salt. If I drink alcohol, it always looks the same.
It's always like that. That's how mine is. It's always the same.
But if
it doesn't change.
More, but does it swell more with sleep?
No.
Like where you said if you don't sleep?
No, it's like this. When I wake up, it's like this when I go to bed. It's always the same.
Okay. Maybe take pictures.
It doesn't go up and down, or it doesn't go up and down. No, this is it. But it's been like this since I was a child. I've had.
Yeah, I have some people that will have that. Like she's one, and I told her to. I'll make it bigger when we finish, so I can show you a couple eyes and you can see. So I can't take away that fat pad. If you want that gone, surgery. And I will tell patients as we get older, like that fat pad will continue to like sink down. The eye bag might continue to sink. And so then you have to, I'm like, you're going to keep aging. At some point, you might want to, think about surgery. But I'll flip through these couple that remind me of yours. And then you can kind of say like, oh, is that worth it? Biggest thing is if your under eyes, if that bag gets bigger or smaller, sometimes I'm like, don't do filler. And you're going to know better than me. Cause I just don't know.
It doesn't fluctuate. It's just a constant.
It's just constantly there.
It's just a constant. And this is it's not like, oh, I wake up and I'm like, oh my gosh. It's always this size. Then that's it. It doesn't fluctuate.
Okay.
This is
I'll show you these when we hang up. I'll like go through these so you can see it on a bigger screen and then look and see, or I can text them to you. But only if you don't get puffy. That's where we can do filler. As much as I can hide the bag, I will. Like here's somebody, I do it in 2 sessions. So we do some, we let it settle 6 to 8 weeks and have you come back, and then we can like fine tune and do a little bit more to try to bring it up. Here's somebody like after her first session. This lady was after she did like 3 sessions. She came for another. This girl did 2 sessions, and you can see, so I'll show you. It's to lift up the
website that we can go on and look at the pricing.
Yeah, so the pricing for under eyes, oh gosh, the pricing is it's like 25, it's around 2,500. I think it's like 2,250 to 2,750, depends on how much you use on the person, and that covers the 2 sessions. I tell people 1.5 to a year that it lasts, but most people are getting way longer out of that for their under eyes. So it's nice. My website is like switching names. So it's been under Ginille Beauty, my name, Ginille, for the past 4 or 5 years, but I'm switching to Jasi. So our new website is coming out this week. But if you look up my name, you'll be able to find my website and then see the different pricing.
Are you able to pin it, or can I text you my in TikTok?
Yeah, if you text it to me, then if you text me, I'll send my number. I'll send you info on it. Yeah, just send me your number.
Because my son lives in LA. He is the director of a gym, and I'm going to be visiting him. And I want to be able to come to you.
Where are you at?
I'm in Virginia.
Okay.
But my son lives in LA.
And make sure, like, so we'll like send you all the information. We'll probably talk more after this before you come. Okay. But just I want to send you pre-care, post-care. I want to make sure it's not like I'm coming to my son and he's getting, some award, like, because you could be bruised, swollen. So I want to make sure.
No, I would be coming for this, not just coming for something for him. Okay. I have 2 kids that live on the West Coast, and so when I'm coming, he's getting ready to turn 30. So I'll be. But when I saw LA, I'm like, well, okay, Ethan lives in LA, so I have somewhere. It's not like you were out in like Arizona, and I don't really have. I wouldn't go way out there, and then not have it. I would have to get some family to come with me. But being that my son lives there, and my daughter lives there, my daughter would come with me.
Okay. Yeah. So we can totally talk through all of it. And I'll probably have you send me some pictures, like, just so we can be even more thorough, is try to take photos, like, in the morning, in the afternoon.
I'm 52, and I don't want to look 62.
I got it. Yeah, I know. A lot of people.
Some people don't think I'm 52, but I still, I'm 52.
I get it.
If it can help a little, I'll be happy.
Yeah, I'll send you some stuff. You can text me, and then I'll send it through. You can either text the number on my page or just in the DMs, and I'll get it after this.
Okay, thank you so much for talking with me. You're amazing.
Oh, you're so kind. You're amazing. Okay, I'll see you soon. We'll talk. God bless you. See you.
All right, bye.
Bye. Okay. Marlene said, how do we make an appointment? So to make an appointment, there's a number on the top of my page. If you text that, my team will help you with coordinating. And then, Marlene, we can talk through questions, goals, tips on what to expect, how to prep treatments. I try to talk with people before they come in, just so you can be prepared. Like I was mentioning last time to the patient, like you can bruise, you can swell. I want to make sure that it's like good timing for you. If you're trying to prep for an event, that we give ourselves enough time before you come in. So we can totally do that. Let me see. She says in Rancho Cucamonga. And then I wanted to flip through a couple of those under eye photos for her. So here's another person. She was feeling like sunken underneath the eyes. She also had that fat pad kind of showing. So I built up a filler like in through her mid face and underneath her eyes to camouflage the fat pad. And then for those eye bags, this is somebody who's in her 30s. I was like, hey, would you do surgery? No. Hey, do you get puffy? Do you swell? You have bad allergies? No, I don't cry, all that. So I lifted up the skin underneath to hide the fat pad. If you want that fat pad gone, guys, that's where you do surgery. And then this is another one. This is a patient I've treated almost my whole career, but like her eyes, we don't have to keep doing, like it is held on. And so underneath that fat pad, building all the skin up around the entire like orbital, so not just here, but also here to hide it. And so you can like, the bag is not gone. It's just I lifted the hollow part underneath it upwards. And she just looks fresh. I have her like selfies after. She looks so pretty. This is another person. This is like right after her first session. So 6 to 8 weeks it takes. So this is like her first session, and then this is 6 to 8 weeks later. And then she came that day, and I added a little bit more to try to bring up that fat pad to hide it. So those are some under eye filler photos. I'll flip through all of these. Not everybody has it where their fat pad shows forward. Okay, some people just have more of a hollow. Okay, let me see if there are other questions that I have missed. I'm turning 49, ready for some Botox. Marlene, let me see your picture. Let me see if I can see. You're so pretty. Okay, if you have never done anything, you're 49, I would say first, make sure, what are you doing skincare wise? Very basic, like sunscreen and a retinoid, using that. And then we'll talk through any skin concerns. Botox is great. People like it for like frown lines, forehead lines, around the eyes. Those are like the most common areas. In the 40s, people also, I'm like, do these neck bands. This helps to like tighten the neck and kind of camouflage the jowls along the lower face. Once we start getting in our, some people it's sooner rather than later, but like the jawline starts looking a little irregular. I got a good photo of this. The jawline starts looking a little like saggy as we get older, and so you can Botox here or you can do filler here to help straighten up the jawline. But I just have to see your face. Everybody looks a little different, even if they're the same age. But yeah, those are some of the things that we can consider. And then someone said, is the blood pressure okay for that patient? Yes. Okay. I had PRF microneedle. The nurse practitioner did at a 0.5 depth. Is it better at a 1.0 depth? Okay. That's what you were asking for Mimi. I think Mimi. Depends on what part of the face you're doing and what your concerns are. So I'll do like a 0.5 depth underneath the eyes because the skin is thinner. And I don't want to like tear that skin. But usually on the face, I'm doing like a 1 to a 1.5 depth. If you have like acne scars, if it's more of a texture concern, yeah, that's where we're at that like 1.5. If your skin, 0.5 is pretty light. That's my honest thing. Like, yeah, most people can do a lot stronger. I do 0.5 underneath the eyes only. Other than that, the rest of the face, I'm going a little bit more aggressive. If I'm doing a chemical peel, that's when I'm going like at a lower depth, so it's not penetrating too deep. So, but I don't know why she did that low. She probably has a reason. I would just ask her, do you have Botox for smile lines? I've tried fillers, but didn't like it. I've not done Botox for smile lines. I've heard some people say you can Botox here and it's going to lift your whole face. I haven't seen that. I feel like it does lift the lower. It like helps to tighten, but I don't think it's going to like take away your smile lines. When we do smile lines, I tell people the goal is not to get the lines all the way gone. We don't want to soften them too much. Give me 1 second. Give me 1 second. Sorry. Okay. For smile lines, the goal is not to take them all the way away. We want to soften them either with filler or the natural filler. If people try to chase them all the way gone, it's gonna look puffy. Also, when you're doing smile lines, I let people know it's not just the lines that we're looking at, but did you lose volume through your mid face? Is that contributing to the depth of the line? So if that is, that's when we're going to be looking at doing some filler through the mid face or into the temples. Do I do marionette lines with Botox? Hey, Bama Mama. Nana, you can do this if you, so here marionette lines are these. Some people, they turn their mouth corners down a lot, like sad. So you can do Botox here and it'll prevent you from like turning down so forcefully. So then people will feel like instead of going down, it's either straight or a little bit curved up. But if it's the depth of the line, like for her, like the lines are deep here, that's when I'm doing filler or the natural filler to help the depth not be so deep. But if it's, I make this sad face a lot, that's when Botox can prevent that muscle from pulling down. So some people are doing a little bit of both, but I'm kind of looking at what the concern is. How do we get a live TikTok assessment? Hey, Fahima, if I think through this invite box you can click through. I don't know if somebody adds in. I just talk to them and we just go on live and we talk through them. So can you see if you can hit that? If you hit that invite box plus, I can try to do that. I created my smile lines in my 30s and now I'm in my 50s and I want them gone. It's too late. I don't know if it's too late. So Sujia just turned 50 and we did her smile lines and I feel like they're softer. They're not all the way gone, but they're softer. So I don't know if it's too late. If they're really, really full, like really deep, remember, just don't try to chase them to be all the way gone. It will look off. Okay, give me 1 second. It's kind of loud where I'm at outside. I'm on a boat, guys. 1 second. Okay, I'm sorry. I'm just trying to like move my little seat over. I'm on a boat right now and I have my 3 kids with me, and I was trying to make them nap, and they're like, "We want to go to kids club." I was like, "Okay, we'll go to kids club instead," and I guess I'll just go online. Okay. Hey, Fahima, I'm going to let me add you in here, and then I will talk through with you any of your questions and concerns we can go through. Sorry. Is it working? Your camera? Okay. I think it's your camera go. Hey, how are you?
I'm well. How are you? Oh, wait, it's working. I'm sorry, I'm new to this.
No, I know. Me too.
Do I
Did
turn
it?
on my camera or?
Yes. It
Okay.
said, you see the request for it?
Yes, I think my camera's off. Okay.
Okay.
1 second.
And so while you're getting that on, guys, I do consults virtually. My team, not just me, but my team as well. We have whole teams of people. We have 3 offices, 2 in LA, 1 is in Vegas. But we'll do virtual consults, in-person consults. We just like to go through your questions, your goals, tips on what to expect, how to prep treatments. We'll talk through a lot. And then on live, we can jump on. Fahima's gonna, oh yay, hi. I'm gonna make you big so I can see you better.
Okay.
How are you?
I'm well. How are you? Thank you so much.
I'm glad we have time to chat.
I'm sorry?
I'm glad we have time to chat.
Yes, again, thank you. I'm so new to this. I don't know what I'm doing with this text.
Sure. No, it's okay. We can just talk through anything you're thinking.
I'll just turn my light. Okay.
Hi, Sherry. Uh-oh. Hey there still? Hi,
Yeah.
Fran.
Okay. I don't know what's going on. Oh. The heck? The heck?
You come in. Let me see. Shrink. I don't even know. Are you there?
Yes.
Oh, there we go.
Okay.
Okay, cool.
I just wanted to get your opinion on a full face.
Okay.
I mean, I don't really have much concerns, but I haven't been able to maintain anything. So I just wanted to know your opinion or your recommendations for me.
Okay. Okay. How old are you?
I'm almost about to be 30. I've had treatments done in the past, not too much.
Okay. Okay. What treatments did you do?
I usually do Botox brow lift, PRF Easy Gel, and I have Voluma and Volbella.
Okay. And then where did you have Voluma Volbella placed?
Voluma was in the cheeks, 1 full syringe, and then the Volbella was about a half a syringe in the lips.
And then is this your standard weight, or are you changing weight, or are you are planning to change weight?
This is my standard weight.
Okay. And then can I see you with your glasses off?
Absolutely.
Oh, so pretty. And then what are you doing skincare wise?
Korean skincare. I do SPF every single day, double cleanse, and then just like Medicube products for a night.
Retinoid or no?
Retinoid. I have
like a retinol or
I'm not sure. I have a Anua eye cream, which is like 0.1% retinol. That's what it says on the label.
okay. I would add in a retinoid in your skincare at like the 20s, 30s. Definitely have that. It helps with skin cell turnover. So fine lines, pores, texture, dark spots. I think you're so pretty. I don't think there's anything that's like, oh my gosh, girl, do this. This is super off balance. I think skin health is like going to take you and people long. You know, I feel like if your skin is great, like everything just looks better on the face. It's, you know, even if you have some volume loss, if the skin is nice, it's still just everything looks better. So I'd really continue focusing on skin health. I think the Easy Gel is like a nice way to go if you're trying to like do collagen stimulation and volume restoration. You don't look like you have a ton of volume loss when I'm looking here, but in the late 20s, early 30s, areas I tell patients to keep an eye on are like the under eyes, like here, for here, and then even this is lateral part, slightly more, you know, you have like full cheeks, and then there's a little bit of like not shelf, but like a little bit of hollow laterally, and I think maybe the corners of the mouth. But I would stick with Easy Gel. I don't think anything on you is like super sunken from what I'm seeing right now, but you're gonna get that collagen benefit long term.
Do you recommend Sculpture by any chance?
Sculpture is nice. That's another collagen stimulator. I think good. Maybe temples. Again, like your cheeks look. It could be. I don't know if it's from your filler or if you just naturally have the full cheeks. But we want to make sure it's not like full cheeks and then like sunken above and below. Very subtle on you, like so subtle. But I think this is an area that like we will keep losing bone and fat. So Sculpture is nice for temples, mid face. But I think yeah, for you, I would focus just keep doing your skin. Your skin already looks good, but like continue that and then collagen stimulators. You look like you have a thinner frame. And so for people with thinner frame, less fat in their face, over time, as we get older, like these fat pads are separating, they start to sink. And a thinner face, a lot of times they feel like they look older than they are because they don't have as much fullness. So for you, I do think the collagen stimulators are just a nice way to never look puffy, never look like you've done filler, but it's going to keep you looking fresh and not like sunken where we lose. So we lose fat here. This will separate. This will get deeper. This will get deeper without like looking like skeletal, you know? So I would just go those ways, like collagen stimulators, skin health, you know, microneedling, aerolase, the bio repill, like things gentle. You're really pretty. Like, you don't even know. So
You're beautiful too. I watch you all the time, but I really appreciate your feedback. And one day I really hope I can make the trip to come see you.
where are you at?
I'm in Florida.
Oh, cool. Yeah, I've got my Florida license. That I see patients a lot from there. New York, Texas, those are like big ones.
Yeah, it's definitely going to be worth the flight, but I really hope to meet you in person one day.
Yeah, do the retinol. Keep with the stuff you're doing. Like, I don't think you need a bunch of filler, and I think if you do the collagen stimulators, it'll stay that way. Not, I love filler, but like, I just think the collagen stimulators are going to age the best on like a face that doesn't have as much fullness long term.
All right. Thank you again. I appreciate that.
Have a good one. God bless.
You too,
Bye.
girl.
I don't know how to turn you off.
I don't know either. Oh my God. I might have to disconnect from the live and come back.
Yeah.
Okay. I'm gonna do.
Bye.
Bye.
Okay. Okay. If I get temple, can I go blind? Very rare risk, but yeah, the blood vessels here also run behind the eyes. So remember earlier I was talking about when we're doing filler, we want to make sure that we're not overfilling an area. We're not blocking blood flow off by putting too much filler in one spot or into a blood vessel where blood can't move like normal. The blood vessels run behind the eyes are from the temples and the nose, so we just want to be careful. But anywhere in the face, like, there's risk for this stuff, guys. I tell people we're looking for your skin color to be normal, no extreme pain, no vision issues. If you had any of those concerns, we would dissolve it. I've been doing this since 2013. This is all I do. This is all I do. This is all I focus on. And I've never had to dissolve anybody for any emergent reason ever. Any part of their face, any filler, super rare. We just want to be careful as we're doing it. Hey, Marlene, are Botox and filler the same? No, they're not. So filler, think of that as going to help restore volume, sunkenness, help kind of create a lifted effect in the face. Botox is going to work on like stopping the muscles from flexing so hard. So when we frown really hard, you get these muscles are moving. Raise our eyebrows, these forehead muscles moving, creating these, flexing this eye down. So Botox is going to stop the flexing so forceful. So then the lines don't get etched on the skin. Your filler is going to revolumize. So when people get sunken under their eyes, the smile lines, the lips, you know, if we're trying to augment the chin, that's when we're looking at your filler. A lot of people are doing both of these. I don't do pico laser. I have heard good things about it. We do aerolase laser in our office and we love it. I was looking at the pico. I went with aerolase because it can do more than just pigment. Pico really focuses on the hyperpigmentation, so dark spots. It is safe for black and brown skin. Obviously, I can flip through these. Oops, sorry guys. I see all skin types, all skin tones in our office. Oh, sorry, that's me. My old photo before I had done anything at 28 years old. Let me flip through some other pictures. But we do aerolase laser. I think aerolase works really well for acne, hair removal. Works good for, and you can combine it same day. Overall skin rejuvenation, the little moles that you can get on the neck, the chest, the face, they zap those really well. Any inflammation in the skin, redness, I really love aerolase. We will combine it same day with microneedling, with chemical peel, depending on the person's skin concerns. So yes, and the laser can be on all these people. So people are like, is it safe for black skin? Is it safe for brown skin? Is it safe? I'm a white girl, can I do it? Like, everyone can do it. Everybody in our office does do it, and they love it. Boys do it. They really like it for acne and redness, hair removal if they're trying to get rid of hair. It works well. Okay, do you think people can overdo filler? Heck yeah, and then they're gonna look bad, Marlene. So yes, the aerolase laser does all of that. No downtime with it, so I really like that. So people will come in, they'll be like, get these. I mean, not that like they have the like moles all over their face. Like, I want them gone. They'll zap those, and they're like, oh, but also make sure my hair is taken away and help my acne. Like, the laser's gonna do all that in one session. So whereas Pico is really focused on pigment, but it's also going to help with pigment with aerolase. You can make your appointment with me, Marlene. So on the virtual calls, I have my other team members as well doing them. But if you're like, I specifically want to see Ginille, you can text the team, and then they can help coordinate like the day that I'm doing it. And depending on the appointment, yes, like they can help you with all of that. Let me see. But I was asking, can they overdo filler? So Marlene, yes, I think people can overdo filler if they're doing too much, too fast. Like, when I look at people, I'm like, dang, you can tell when you walk around the street and there's like, they look bad. Like, that's not it. We don't want you to look weird. That's the biggest thing. So that's why I tell people, don't focus on just one area. Don't just do your lips. If you're just doing your lips, but these are sunk in. That was Sujia. She came to me and we were doing lips and Botox, and then she wanted that again, and I was like, ma'am, if we do this again, like, your lips are popping, but this looks sad, this is back, this is not gonna work. So we ended up treating her full face. We did cheeks, smile lines, corners of the mouth, the chin, help to support like the jawline. So all the different areas we want to treat when we're doing it. You don't have to. Not everybody's face is going to have these same signs of aging. Not everybody's, everybody's face is different, but we want to consider the full face when we're doing something, or how can treating one area impact another part of the face when we're doing it. But I think when people are going too fast, like doing too much, too quick. Oh, my injector let me do my lips and they said come back in 2 weeks and they added more. I'm like, 2 weeks? Like, your swelling isn't even down. Give it 6 to 8 weeks to settle, then reassess, then talk about should we do more. And I'm trying to flip through these just so you can see some of the patients that have treated in the office. I've got thousands of patient photos that have consented. These are just some that I have put together. And so I always say shout out to the patients, because if it weren't for them, like, you guys wouldn't know. If you just look at the after, you wouldn't think these people have had Botox and filler all over their face. And that's the goal. Like, I want it to look like you. I want it to look fresh, not overdone. Like, this girl is so beautiful. Like, people wouldn't even be able to know what she did. So for her, she came in and she felt like her chin set back, and she's like, I feel like my lips look ducky. She'd never done anything so dang beautiful. She's like, I feel like from the side my lips like overpower the lower face. So for her, we did filler into her chin to bring it forward. But if you just saw her walking around, you were just gonna think she's beautiful, not, oh, she's got filler all over her face. That's the goal. She had lost 100 pounds, and so she felt really sunken, like underneath her eyes, into her cheeks. Her chin was sitting back, so we did filler her cheeks, her here. She wanted lip filler just to like have a little bit more pop. She felt like her cheeks were more sunken, so we were trying to create that highlight to go up and lateral back, so we did filler there. And then her chin was a little shorter, and she wanted some length and some forward projection. For her, it was under eyes and a little bit into the cheeks. She was trying to camouflage that fat pad. Remember, we all have the fat pad. Some people bulge out more than others. So yeah, and they look fresh, like they look like themselves. She didn't like the bump on her nose. She wanted it straight, and she wanted the tip of her nose to be upright, so we camouflaged the bump. She came in, she was like, my family won't let me get a nose job, but they said I can do this thing because there's no surgery with it and there's no downtime. And so we camouflaged the bump of her nose. We lifted the tip. We made it look straight and no downtime. It's not like when you have surgery, my patients are like, I did surgery for my nose, but they said I don't know the full result for a year. I'm like, dang, that's a long time. You know the result like right then and there. Here she did some Botox to soften the dimpling in her chin. She felt like when she talks, she's like, I always see the dimpling. Like, what is that? So we did some Botox to smooth through there. And then this patient did some lips, so cute. This is me on the boat feeding my baby. My goodness, that baby. He's big. He's 2. Okay, me too. I've lost 70 pounds so far, and I really want to refresh myself. So, Marlene, yes, I've seen a lot of people after weight loss, especially this past few years with GLP-1s. Like, so many people are like 20 pounds, 30 pounds, 70 pounds, 100 pounds. 100 is the most that I have treated for somebody that said they'd lost 100, and they're like, my face changes. When we lose fat, we also when we lose fat, like weight, we lose fat in our faces as well. And that's when people will feel like, oh, I don't look as lifted, I look more sunken, my cheeks, like I don't have the fullness. And so then they feel like they look a little older or just not as like tight lifted. So that's when we can be doing filler. I have other views of her, but this is just one of them. But she came in after 100-pound weight loss, and I thought that was, I've treated multiple people with weight loss. Okay, let me see. But the goal is to still have it looking like you, not some like crazy different face. Fahima says she loves Aerolaze. I love Aerolaze too. So great. Okay, let me see. I'm 25 with hollow under eyes. I'm looking for permanent treatment to improve the hollowness for Lula. So permanent, I don't know if anything is permanent. You can ask surgeons if, like, I don't even think fat transfer is permanent. Nothing that I do is permanent. So the fillers are going to eventually break down. However, they can last a long time underneath the eyes. When we do filler, I tell patients 1.5 to 2 years. Most people are getting longer. They're like, you did my eyes 4 years ago, it's still holding. And I'm like, great. But that's also why we want to do it the right way, and we don't want to rush it, we don't want it overdone, because if it looks bad, I don't want it looking bad for a long time. So that's why I tell people, go slow, wait the 6 to 8 weeks. Like, it's easy to add, we can always do more, we just don't want it overdone. Okay, let me see if I notice that I look a lot younger. My hair is curly and short. Me too. I mean, I haven't straightened my hair in probably almost 8 years, maybe longer. I used to wear my hair straight every day. But when I would get out of the shower, it was like coming out straight because I was always straightening it. And I was like, oh, sheesh, this is not good. My hair is straight coming out of the shower. So I just stopped, and I sometimes think about it straight, but it's like, no, I don't have time for doing all. I don't want to be messing it up. Okay. Let me see if there's other questions I missed. If there's anything, please let me know. But Lula, other things you can consider for under eye hollowness that are not permanent, you can do filler if you're a candidate for it. So if you don't get puffy, if you don't cry a lot, if you don't retain water around your eyes, you can do filler. Or you can do the natural filler. So the natural filler is made from your own blood. We draw your blood, we spin it in a centrifuge. It separates out your growth factors and stem cells. We take that part and then we heat it, we cool it, and we make a gel out of it. We can put that underneath the eyes and it will create new collagen over time. I think that's really nice, Lula. Like 25, I don't know how deep the hollowness is, but that one's going to make new collagen. In the 20s and 30s, I'm like, you're still making nice, good collagen. You're not losing it super fast, so you're probably healthy. I would say the natural filler, but you can also do traditional filler. Oh, let me show you my under eyes from, this was when I was 28. I'm 38 now, guys, but this was me, and after I had my first kid, I showed you me feeding that big baby. He's 2 a few minutes ago, and I've breastfed all my kids for 2 to 2.5 years. I know it's like a little hippie like, but I felt like he sucked all the fat out of my face. Like my under eyes look really sunken, my cheeks are getting like sunken through there, like everything. I just felt like I look like haggard, tired. I was really tired, but I'm like, why do I look like this? Like, I have no fat in my face. And so that is where I did filler under eyes for the first time, and into my cheeks. I have done filler into my chin, my temples, the corners of my mouth. I've done filler like here, like the smile line part, like the top of the nose. And the past 2 years, because I'm breastfeeding, I can't do filler. I've been doing the natural filler, the natural one made from my blood. At first, when I did it, I was like, I don't see any change. This is dumb. Like, because it's not quick. It does get better over time, though. So over time, I was like, dang, I don't look so sunken. I don't look so hollow. Like, I never look like this again. And that's 10 years ago. And I have 3 kids, and I'm older now. He's actually, my oldest is turning 11 in a week. So it's almost 11 years ago. So it gets better over time, the natural one. So I hope that helps your question, Lula. Okay, let me make sure. I noticed that. I want to make sure I didn't miss anything. If you have other questions, please feel free to jump in, ask me the questions, and I will help answer them. We've had what helps with the jowls. And Marlene, if you want to jump on, we can also just talk through here as well. So with jowls, so this is where people will start noticing over time, this little fat pad starts to sink. I don't like to pull it because I'm not trying to add to it. So the jawline won't look so straight. You can see it on me. very subtly, like very little. But I try to hide those things with like the natural filler. So with gels, a few things you can do. You can do Botox. Watch here. So this muscle, this is our neck bands, platysmal muscle. You can do Botox into here. Usually this aligns with where the jowls run. So when we Botox here, it kind of helps tighten the jowls along the jawline. If it is, I need to put this picture together and like have it on my phone. I just need to do it and I haven't done it. You can also do filler to camouflage in front of the jowls. So for Sujia, I did filler here. You can see, look at her jawline. Not me, her. I need her to be bigger, not me. Okay, you can see before her jawline was kind of like curved. So we did filler in front of her jowls. So we did right here. And then I got to do some into her chin because I don't want to make her face wide. So I did some here and I did some into her chin. And it just looks like so much straighter. And then we softened the corners of our mouth right here, these marionette lines. So the line is not so deep. It's not looking downturn sad. So that's what you can do for jowls. If it's like really a lot of fullness, we can also do, so aside from Botoxing this, filler here and into your chin and into here, you can also do fat dissolver. So Kybella, you can do right into this part if there's fat right here, if it's fat, and then you can permanently dissolve that. Can take a few sessions, but it does tighten and people like that. I have some good photos of that. I just don't have them like snapped through here. I want to have them all lined up so I can click through. I just didn't snap that one. What about PDGF? I noticed injectors stopped doing them. That is for Kimmy. So PDGF, it's not FDA approved to inject, and people were injecting that, and then some people were getting bad outcomes, poor outcomes with it. We want to be careful. I tell you guys all the time, I'm like, when new stuff comes onto this market, do not be the first one to be like, I'm trying that. I am so slow to bring things into the office because if I do something, I got to stand behind it. I need to understand, like, I need to get the result. It needs to be safe. And if there is a complication, I didn't know how to intervene. So PDGF, like they've used it in other areas. My husband is an oral surgeon. And so when I was talking about it, he's like, oh, that's really safe. Like we use that all the time. I don't know what he does with it in the mouth, whatever. He's like, that's totally fine. I was like, yeah, but like in the aesthetics, we haven't been doing it. And then some people are saying like they're doing it under their eyes and they're getting puffy and it's lasting for a long time. So it's just like, you want to make sure. I would not want to be the first one put in my face to try it out. Let the dust settle when these things come. I usually say give it like some time, because you guys have probably seen stuff come and go in aesthetics. I know I have. I've heard, Morpheus, Daxify, like all these things. The companies will put a lot of money behind them in the beginning, get the providers hyped up, get the patients hyped up, and then if it doesn't pan out, it's like, okay, now what? So I would not do that right now. I don't want to be saying like it's illegal, but it's not FDA approved to do. So we shouldn't be doing it as providers. And again, I'm a nurse practitioner. I went to Stanford. I went to Duke. Like, I'm not trying to mess up my license. I'm not trying to mess up the license of my team. I'm not trying to mess up people's faces. Yeah. Harmony, I don't know what that is, Kimberly. Can you tell me more? And then I'll see if I can tell you. I don't know what that is off top. Okay, let me see if there's other ones that I have missed. I don't think I have. Okay, other things I've done. So besides, okay, let me tell you guys like the spots that people don't think about that do make a big difference. And I think everybody thinks like under eyes, smile lines, lips. I'm like, yeah, I know, under eyes, smile lines, and lips. But are you thinking about your chin? That's a big one. Like if you're not thinking about this, if your chin is set back and you got these lips that are full and they're like dominating the lower face, it's gonna look bad. Your jowls are gonna like show more. So chin is a big one. Don't sleep on. If your chin sits back, you gotta look. Remember, from the side profile, we want to think about it, not just like from the front. From the front, is it short relative to your other features, or is it set back, relative to your other features? That's where chin would be really nice. I have done so many chin fillers, and majority of my patients have some in their, I'm not saying everybody, but a lot of people, it does help really balance the face. It's one of my favorite things I did to my face. My chin used to just be a little bit shorter here. And I didn't know, but like back when I was in college, whenever I felt like I was trying to take cute pictures of myself, my mouth was always like, I'm smiling here, but like if I was trying to like, I'm taking a sexy photo, like whatever, a cute photo, my mouth was always like open. I didn't know, but what I was doing subconsciously is trying to give myself a little bit more length, because my face looked better when it had the length, because my chin was short. So chin is a big one. Don't sleep on. And then another one is temples. right through here. A lot of people don't think about this, and I'm like, okay, people, you just keep doing cheek filler, because you're trying to make these cheeks look lifted, and you're trying to offset the smile line, but then all of a sudden these cheeks are built up, and then above it, it's sunken. We lose bone here, we lose fat here as well. It can look sunken, it can really make the face look aged. Some people just don't get it, like, and then I'm like, no, you don't understand, like, it looks like a cone head, it looks sunken, like, that looks not great. I have done these parts, and I feel like they have made such a big impact on my face here and here. When I've done temple filler, I have gone and I go to check the mail, and this guy was like, can your mom come sign for this? I was like, sir, this is my home. I have 3 kids. No, my mom cannot come sign for this, but thank you. Let me actually go see if she can. I've gone to my kid's school. He's K through 8, or K through 12, his school. And like, the nurse was yelling at me because I was trying to go in the nursing office to pick him up. She thought I was a student, not listening to her. And I was like, ma'am, like, I'm here to get my kids. She was like, I'm sorry. But it was a temple filler. It was after the temple filler. So don't sleep on temple filler or your collagen stimulators. You can do natural filler, PRF, easy gel, or you can do dilute radius, or you can do Sculptra. But like, we lose fat here. Also, then like the eye won't have as much support. This will look sunken. The cheeks will dominate, and then the temples are sunken. It looks bad, especially if you're doing cheek filler. It looks like, I don't want to say like you're trying too hard, but I know you guys walk around and see people that just have like cheeks. It looks bad. You got to think about the full face when you're doing your injections, okay? Okay, let me see if there's other. Hyaluronic acid helps you get volume and produce collagen. Let me see, Kimberly. Oh, harmony. Are you meaning just like facial harmony, like facial balancing? Yes. If that's what you're meaning. I didn't know if harmony was the name of a treatment that I can't think of right now, Kimberly. But yes, you can use hyaluronic acid filler. You can use Radiesse, it's a calcium-based filler. You can do the natural filler, or you can do. She said, no, it's a name in Mexico. It's a treatment. I don't know. I have to look at it and see what it is. What I know is stuff that's FDA approved in the United States. So I practice in Los Angeles and Las Vegas. I've got 3 medical spas. So the other countries, a lot of countries will have other treatments and like products that we don't have that are not FDA approved in the US. So I just am not as familiar with them. Is it their pills for melasma spots? So if you've got melasma, Marlene, first thing is sunscreen. You probably already know this, but sunscreen, reapply your sunscreen. That's a big deal. Then you want to be using like your retinoid and tretinoin, and a hydroquinone. Hydroquinone you can do sometimes, not all the time. So hydroquinone is going to suppress the melanocytes, the pigment making cells. You can use it for like 3 months, max 5, and then take a pause. If you keep using it long term, it can make those dark spots darker. We can do the chemical peel for you can do the Aerolase, you can do the BioRefill chemical peel, you can do microneedling for melasma. When we do these, I still say, hey, we want to tread lightly and be careful, because melasma, anything can trigger it, and I just don't want it to be worse. But the biggest things are going to be your sunscreen, your retinoid, your hydroquinone part-time. So hopefully that she uses the creams and it's helped, and then staying out of the sun, and then trying to avoid your triggers, which is so hard because some people are like, it's like if I just get hot, if I get stressed, my melasma, Favorite microneedling device is skin pin microneedling. That's what we use in our office. I don't use RF microneedling. I have used them in other practices when I used to be in other practices. But like skin pin microneedling, tried and true. I really like it because they've done so many clinical trials behind their device. They said they completely sealed their device, so like no blood product, nothing can penetrate inside the device, which is important to me. They have a completely sealed system where like once those needles are locked out, you can never recap and reuse those needles. I was looking at other devices in the beginning because skin pin is more expensive than the other ones. And like I was talking to colleagues and I'm like, oh, whatever, I'm not going to be naming these names off that they're using. I'm like, how do you like it? And they're like, oh, it's cool, but like sometimes I have to like try to clean like the blood with the Q-tip like out of the device. I'm like, what the F? Like, ain't no way I'm gonna be like risking that on people's faces. So I'm like, yes, I'll invest in the best things because I'm not trying to have any problems for my patients. So skin pin is great. They've done so many clinical trials. Safe for all skin types, all skin tones. Great for acne scars, great for texture, neck wrinkles, collagen stimulation. minimal downtime with it. You want to stay out of the sun. It's important. And then you want to, you guys hear all these kids screaming? You want to have nothing on your face for like 48 hours, hair off your face, hands off your face, clean pillowcases, no pets, no kids, nobody touching your face. You just don't want anything getting in those microchannels. But our patients really like that. We can combine it the same day with the laser and or microneedling and or the biorefill chemical peel. So I'll have some people that come in and do all three. Some people will just do one or the other. So it really depends on your concerns, your goals, your downtime. That will determine like how we pair up these skin treatments. And we have a skin membership program in our offices where you come in on a monthly basis and you can pick from any of our skin treatments: the skin pin microneedling, Aerolase laser, biorefill chemical peel, hydrofacial. We choose based on your concern for that month. It's $3.99 for the month. If you want to add on, so people are like, oh, I want to add on another treatment. I wanted to peel and microneedling. It's $250. Or if you want to add on your neck and chest, it's $250. But yeah, people love that, and like their skin just looks so dang good, especially 6 months in. People that keep going like a year out, it's like their skin is completely transformed. So dark spots, like it just looks so bright. Acne control, we work really well on. Dark spots are big ones, just like the firmness of their skin. So skin health is big, and we're pairing this at home with the appropriate skin treatments. I should probably go get my baby soon. What would I recommend for someone with a bunch of tiny clogged pores on their forehead? The hydrofacial with the chemical peel. That is my favorite right now. I feel like I don't like saying favorites because I like them all and I use them all. But the chemical peel, great for turning over skin cells faster. It's gonna brighten, bright. But the hydrofacial will make it where you're not like dry with it. The chemical peel we have, the BioRepill, safe for all skin types, all skin tones, everything we have in the offices. It's not like a crazy peel where you're peeling. I did it like 4 days ago. So you can see I have like a teeny bit of like flaky around my nose, but it's not like you're peeling sheets off, which I really like. You can do that. The company says you can do it every week. I think that's a little too aggressive. I would say like every 2 to 4 weeks, but pair it with the hydrofacial, and the hydrofacial is going to deep clean out your pores. And then we're going to put the peel on at the end of the hydrofacial. I wasn't trying to hit you, Evan. I'm sorry. I didn't mean to do that. I'm so excited to start. I hit invite to you. I was not meaning to. Sorry. Okay, I was trying to scroll. Marlene, I'm so excited to see you too. And like I said, we can talk through questions, goals, tips on what to expect, how to prep treatments. We're going to go through everything. Like we do a really thorough history talking about what are you prepping for. You said you already told me you lost 70 pounds. Are you planning to lose more weight? All these things I'm kind of asking. Let me see what you're doing skin wise. We'll kind of fill in, hey, maybe you could switch this one out, or I don't know if this is actually doing any good for you. We'll talk through that. You said you had some concerns with melasma. So I can talk through all of the things. We really focus on like natural results. We focus on skin health, hair health. We have a whole weight loss and wellness program, but you already got that going, so that's awesome. Okay, if you have other questions, please let me know. How do you feel about microcurrent? I have the zip. I like microcurrent. I have the, what's that one? I have the New Face, but you have to do it you have to do it. If you're not doing it, it's not gonna, obviously, you're not gonna see the benefit. But if you continue doing it, I think it works well. For just like giving you some of that initial like little tight, okay, oh, I messed up. I don't want to do that. I'm just gonna type in, I was not trying to do this, guys. I was trying to scroll, and then now it's saying like type something. So here's my website, Ginille Beauty or Jasi Skin. Those are my my company names. But I don't know if I sent that to someone or the things. Okay, let me see. Okay, so excited to start. Okay, if you have other questions, let me know. I'm probably gonna go check my babies. We're on a cruise. We do a lot of cruises because it's something that's like quick and easy, and they love to go to kids club and I can chill. Please call or text the team. You can hit the number in my profile. You can send me a DM. Sometimes I miss them, so as I'm like calling or texting the team, is going to be just the best way. Thank you so much. I go to Florida a lot for them too. So that's why I was like, let me get my Florida license. I go for HEMA to Florida a lot. We were there in July. We're going in December. My husband's like, can you do something different? But it's easy with the kids. But I appreciate you guys. If you have questions, let me know. Oh yeah, where are you at? Yeah, where are you at? And we go to so many boats. People are like, you're a cruise person, but it's chill. Please let me know questions you have. Call or text the team. We're in Los Angeles. We're in Las Vegas. We treat all skin types, all skin tones. We focus on having you look your freshest self, never overdone. Like I said, that was me at 28 before anything. I'm 38. I've got 3 kids and they're running me ragged. I have seen people on this boat that have been like, I watch your TikToks. And I'm like, oh, thank you. And I'm running ragged behind my children right now. Orlando, girl. We're there all, look at, why am I wearing this Disney shirt? I obviously, like, I never wear this out besides on the boat. Yeah, so we're there all the time. I will see you. I have seen patients when I go there for cruises that like somehow connect with me and like we go meet up. But yeah, if you think of anything, please let me know, you guys. I appreciate you. Marlene, yeah, send a text to us. I will connect with you soon. I think you said you're in Rancho Cucamonga, so all right guys, I appreciate you. Have a great day.